Good morning, class. Thank you so much, Dan, for that good opener. My name is Emily Simmons, and I'm going to be going over our slideshow. So, welcome to the CBI Heat Illness Training. The training is set to provide you all with some great information regarding heat illness and the various types of illnesses caused by heat, their symptoms, and how to assist someone suffering from heat illness, as well as some preventative measures. If anybody has any questions at all at any time, you can raise your hand and I will come by and assist you, or even help clarify questions as well. So let's get started. So the first thing we are going to do, I'm going to pass out a pre-test. This is just to get some base knowledge to see exactly what everybody knows, and just to give us a baseline to see how effective our training is for you guys. So I'm going to give everybody 10 minutes or so to complete this, and then we will get started. It looks like everybody is finished with their pre-test, so we are just going to jump right into this heat training. If anybody has any questions or concerns, just please let me know and we can go over that. So the first thing I want to talk about is some different types of heat illnesses. It's good to know the differences between them, just so you guys can identify exactly where you are, okay? So we're going to start from like some of the lower end illnesses that aren't as life-threatening, such as heat cramps. I'm sure some of you, especially people working out in the heat, have experienced some of these. The first one is heat cramps. You know, they're painful, involuntary muscle spasms that usually occur during heavy exercise and hot environments. So definitely, if you're starting to have experienced heat cramps, I think it's best that you take a break, go inside, drink some water, get out of the heat for a little bit before it progresses. Another heat illness is a heat rash, okay? This is an itchy rash with raised spots. This occurs due to excessive heat. Again, neither of these are life-threatening, but they could lead to other illnesses. The next one, when you're starting to get a little bit more serious, is heat exhaustion, okay? Our bodies respond to an excessive loss of water and salt. This usually is through excessive sweating. Our skin becomes moist and cool. The pulse rate will be fast and weak, and breathing will become shallow and fast. If heat exhaustion is untreated, it can result in a heat stroke, which is very serious. So if you begin to feeling like you're experiencing heat exhaustion, it is mandatory that you do take a break, because your body needs time to cool off. And yeah, then the next heat illness, which is extremely dangerous and can be life-threatening, is a heat stroke. This is the most serious related illness. This occurs when the body can no longer control its temperature. The body temperature rises rapidly. The sweating mechanism fails, and the body is now unable to cool itself. This can cause serious illness or even death without treatment. Actually, roughly 80% of heat strokes can be prevented. Heat strokes can set quickly over the course of 10 to 15 minutes, or slowly developing over hours, so you just never know. So when you're starting to experience these, it is extremely, extremely important that you take these signs and symptoms seriously. It's also important to monitor the people around you, because some people are unaware of the symptoms that they are beginning to feel, because it can cause, dizziness, loss of consciousness. Sometimes people aren't thinking correctly. So yeah. So we are going to move on to the next slide. Now we're going to talk about how the body gets rid of heat. And one of the main things is, in my opinion, sweating. I think that is very important to cooling yourselves off. That's why when you start having a heat stroke, you do stop sweating. So it is extremely important, because your body is not regulating its temperature anymore. So actually the four main methods are conduction, radiation, convection, and evaporation. So some other ways you can cool yourself off: you can remove articles of clothing. You can lean up against a cooler surface. You can have, air blowing on you. You need to get to just a cooler area, whether that's in a car with air conditioner, whatever you need to get yourself cooled off. Okay. Now we are moving on to heat illness list and preventative measures. So a heat rash, again, that's just a prickly heat rash with bumps. It's very uncomfortable. A cause is heat buildup in the skin due to clogged pores and sweat ducts. Prolonged skin wetness from sweating. Okay, some symptoms. Area becomes red, itchy, and it can hurt. It can even cause blisters. Some good first aid practices is good hygiene. Keep the sun clean and pores unclogged and allow the skin to dry. Wear loose clothing. And also a good recommendation is to see a doctor if it persists over several days. Again, this is relatively minor. It's just the beginning of some of the heat illnesses. Next are heat cramps. The cause of this is a loss of important electrolytes in the blood and muscle tissues due to excessive amounts of salt being lost in the victim's sweat. Some symptoms include cramping of either voluntary, which is your skeletal muscle, or involuntary, which could be your abdominal muscles, or even both. First aid, I would definitely recommend drinking lots of water, replenishing your electrolytes. Gatorade's a great source of that. Powerade is also a good source. And you need to rest in a cool environment. Full recovery is necessary before going back into the heat stress condition, so it can become more serious if these heat cramps do continue. Okay, and now we're moving on to heat exhaustion. The cause of this is dehydration, high humidity, high temperature, and physical activity. Symptoms of this can be dizziness, nausea, weakness, headache, blurred vision, profusive sweating, cold, wet, clammy hands. Your skin can become grayish, unconscious, coma, and even death. So heat exhaustion is very, very dangerous. Some first aid measures you can take if you think you're experiencing this is you need to be placed in a cool location. If you cannot get yourself there, you need to have somebody else take you there. Remove any tight or unnecessary clothing. Fan or apply cold water to the body. Administer fluids to the victim, especially if they are conscious. If unconscious, you need to seek medical care immediately. Do not call your supervisor first. If somebody is unconscious, you need to call 911 and have them treated ASAP. Now we are moving on to what is called a heat stroke, which is the most serious illness, okay? The cause of this, the body temperature regulatory mechanism located in the hypothalamus fails and sweating stops. Core temperature of the body rises dramatically, and the victim's condition can become very serious and life-threatening. The victim is unlikely to be able to reverse the condition without assistance of a medical professional. Some symptoms you can look out for: chills, restlessness, irritability, euphoria, red face and skin, disorientation, hot and dry skin, but that's not always a symptom, but they can be. You may collapse, unconscious, confusion, convulsions, and again, even death. So it's very, very important to take this seriously. First aid recommendations would be immediate aggressive cooling of the victim's body using wet clothing, emerge into cold water if at all possible, and transfer to emergency medical facility immediately. Again, the seriousness is very, very high. A heat stroke is a medical emergency. Again, it is a medical emergency. It is not something you guys can just brush off and think that you can just treat yourself. Without outside intervention, the victim will die. Okay? By the time the victim realizes he or she is in trouble, it is usually too late to employ effective self-intervention procedures that can reverse the thermoregulatory failure, okay, and reduce core temperature. Recovery time from a heat stroke are generally the longest of any heat-related disorder. So we are going to go over some preventions. So how can we prevent heat illnesses? Heat illness becomes a very real concern when temperature rises. There are a few things to recall. If your job requires you to work out in the heat or you are standing in the heat for long periods of time, always stay hydrated. Avoid standing in the sun when possible. Beverages such as coffee and energy drinks actually dehydrate you. So definitely watch the amount of intake you take of those. Alcohol also, it can dehydrate you even if consumed the night before. So please keep in mind that even at your best on a hot day, heat stress is very possible. The risk increases when you are not your best. Please stay home if you are not feeling well. Okay. Some controls and management can include providing fans or shade, wearing your proper clothing, adequate training, and please continue to drink fluids throughout the day. You should be drinking water every 10 minutes at least. Although heat illness is a very serious concern, it is completely preventable. Learning the signs of heat stress is also important. Dizziness, headache, nausea, rapid heartbeat, cramps, chest pain. Some preventative methods include using loose, breathable clothing, taking rest periods as needed, utilizing hats and sunblock. Remember to maintain hydration, avoid caffeine and sun exposure when at all possible.